So my name is Dr. Saima Khan. I'm a family physician by training. I got my training from Western Ontario. And I always wanted to be a physician. I think that was kind of a mindset I was brought in to help. But during my journey with family medicine, I found that there's so much I can offer to my patients, but life kind of went in monotonous. So I thought maybe I just want a little bit of, more chaos in my life. So I entered into intervention pain medicine. So this is a field where most of the people will say I'm unable to help patients because there's not much to offer. But I took that field and I learned some interventions to help my chronic pain. And I found out when I was treating my patients who suffer from chronic pain that the biggest challenge for them is their mobility because of their weight issues. And I wanted to help them, but I couldn't. And then I found kind of a new scientific approach how to deal with this difficulty. And sort of unconsciously, I was managing my patients who suffer from pain, their obesity as well. And then when the new guidelines came and it opened up the doors for us, I found that I have so much tools to offer to my patients. So now I call myself that I'm a family physician for people who suffers from chronic pain and obesity, and that's what I do all day and all night. My vision for my patient is that when they get to my program and to get to know this, I'm able to give them confidence. I'm able to make them so that they become kind to themselves, and I can give them tips and strategies how they can maintain their weight, because that's the biggest thing. Weight loss is easy, but how to maintain it? So I want to empower my patients by giving the right tools and strategy to have a sustainable weight loss, and along with that, they can have the purpose to life as well. So that's my vision for my patients. I want to empower my patients by providing them the right kind of education. And that's what I'm all about. So the more aware you are, the more you're aware of the problem and the struggle. And that's how you can overcome the challenge. The acknowledgement is that my goal here is to make patients acknowledge and provide them with whatever the tools they have. I would say there's many things unique to it. The reason is that we now know a lot about why it is difficult to lose weight that we didn't know. When I went to med school, we were not taught about all these fancy medications. We always thought it's all about eating less and moving more, but now there's more to it. So what I would like and what I would have done is that I have incorporated recent research as well as a lot of a mind game psychoeducation in my program. So I would say the biggest thing in my program is that I don't look at the numbers. I'm not here to treat patients' number. And that is my first disclaimer to my patients that, see, I'm not here to make you 160 or 170 or the weight that you had 20 years ago or the weight you had on your wedding day. What I'm here for is to help you reduce 10 medications that you're on. If I can able to cut down to half, if I'm able to help bring your diabetes, if I'm able to fit you in the MRI machine, which is a struggle for you, if I can help you reduce your back pain, knee pain, neck pain, then this is what I'm here for. So I'm totally here for not for cosmetic, aesthetic, but for the medical, mental, and overall well-being of yours. What I offer is not unique. This is what the current guidelines says how to treat obesity, which is a chronic disease. So any chronic disease requires not just one approach, but what we call as a multimodal holistic approach, and that's what my program offers. So my program offers a lot about patient education. So I educate the patient. I'm very big into psychoeducation in time. So the concept of cheat day, the concept of eat whatever you want and then go on starvation, food restriction. So that's not there. So it's all about mind change, mind game. And then there's a big into nutrition. So in my program, there is nothing called as food restriction. You won't find food restriction. It's all about calorie restriction. So you eat whatever you want, but within the bounds. And then lastly, we know now that the obesity is a disbalance between, or the fight between, the hunger and the appetite hormone, and we have now medications for that. So this is what I offer to certain clients of mine who has these struggles. So the medications part. So medication, psychoeducation, nutrition, and physical education. So these are the key things in the umbrella of constant, consistent approach.